What is going on, guys? Thanks for tuning in to the next episode of the Three Peaks Fitness Podcast. I'm Coach Mark.
I'm Coach Lynette.
And today we have a very special guest. We have Dr. Veronica Brugmann of Alpha Project Physio and Performance.
Nicely done.
Yeah. Thank you for coming on.
Thank you for having me.
Yeah. So why don't you, kind of give the rundown to our audience? Who is Dr. Veronica? What does she do? What's her deal? Give us the 90-second elevator pitch.
Okay. So I'm a pelvic floor physical therapist. So I'm a physical therapist and I specialize in pelvic floor dysfunctions. And so a lot of the things that I treat are postpartum women. That can include diastasis recti. I treat any type of leakage. I treat prolapsing, tailbone pain, any pelvic pain, pain with intimacy. That is a lot of the topics I treat, which I see a lot postpartum, but also people who are not postpartum can have those issues too.
Mm-hmm. Yeah, I'm fascinated. I don't know a ton about this, so I'm really excited about today.
Yeah, me neither.
Yeah,
that's awesome. That's awesome. Cool. So how did you kind of get into that realm? How did you get into that field?
So I always just thought it sounded cool. I don't have like a great story, but I first heard of it in college because my roommate in freshman year had endometriosis, and she would be like in a lot of pain all the time. She would be like curled up in a ball on her bed.
Wow.
Some days. Yeah. So she had a lot of pain, and she ended up going to pelvic floor physical therapy. And that's when I first heard about it. And I was like, that sounds like a really cool way to help people. I really like it. It's within physical therapy. So that's everything I like to do. And then in physical therapy school, I took like a little weekend elective on it. It was one of the electives that we could take. And I was also like, okay, this is cool. I would like maybe do it one day. And then I graduated and I was working at just like an outpatient clinic. And I saw an opportunity. There's a lot of need in the area to have another pelvic floor physical therapist. So I saw the opportunity and I just went online and signed up for a class. And it's a weekend course, so I drove to Massachusetts and took a class for the weekend and drove back, and I started treating pelvic floor patients the next day.
Wow.
Yeah.
That's awesome.
That's cool.
Very cool. Very cool. Very cool. So what sort of like dysfunctions do you run into most frequently in your line of work?
I would say probably my most frequent one, and a lot of times all the dysfunctions overlap with each other. But I would say one of the main ones is leakage, like women who leak when they're lifting, when they're running, jumping, coughing, sneezing, or sometimes on the way to the bathroom if they have a lot of urgency. Mm-hmm. So I see a lot of leakage. Usually it's urinary. It could be fecal too. And then I also see a lot of, I would say one of my favorites is diastasis recti, where the abdominal muscles, they separate. The left and the right side separate from each other when you're pregnant. Mm-hmm. And then after pregnancy, they don't always come back together as close as they were before. And that can cause, then your whole core is not working, right? Mm-hmm. So that can cause low back pain. It can cause leakage too, because then your system isn't working correctly. So it can cause a lot of different problems. And also people complain about their, quote, mom pooch. That can be related to diastasis sometimes.
Okay.
So we have to like learn how to retrain your core. And there's a lot of mobility that goes with it typically. A lot of mobility deficits that I see with it. Tailbone pain's another big one. I like treating that too. I should have brought my pelvic model. That would have been great. But the muscles of the pelvic floor, some of them attach to the tailbone. So it is very, very related. Then we have to go work on the muscles of the pelvic floor because they directly attach to that structure.
That's
and then
fascinating.
Yeah.
Is there an event that causes that, or is that just a chronic thing that happens?
Sometimes there's an event, like sometimes someone will have a slip and fall on their tailbone, fall on their butt. So sometimes there's direct injury like that. Sometimes it's during childbirth, there's a direct injury. Mm. And then also sometimes if someone has tightness in their pelvic floor for whatever reason, those muscles get tight and like tug on the tailbone, so that can cause pain too.
Wow, okay. Interesting. And that can happen. That's not unique to females.
No. I've treated men for tailbone pain also.
Okay.
It can definitely happen if they carry, they have tight pelvic floors, if they carry a lot of their stress in their muscles throughout their whole body, then the pelvic floor can be included with that, and that's when we see tailbone pain sometimes with men.
Okay.
Interesting. Would you say like any of these dysfunctions are in any way, shape, or form related to like the modern lifestyle and how sedentary we are?
Yeah, I like that question when I read it. So when I read dysfunctions unique to the modern lifestyle, since COVID, there's a couple things that it made me think of. So since COVID, a lot of people went to working in the office to working from home, and maybe their ergonomic setup isn't as good as it was in the workplace. So I see an increase in tailbone pain. Like the one guy I treated for tailbone pain, it wasn't a problem before COVID, and then like transitioning to home, I think it's stressful, the whole situation of COVID for most people.
Yeah.
So you're carrying more stress in your body, and then you're sitting on maybe a not so good chair at home, stressed out about your work situation all day and your life situation. So I've seen a lot of tailbone pain since then.
Wow.
And then the other thing I thought of too is since people are working from home and they have their bathroom available like 2 feet away from them at all times, sometimes it trains people to have not as good bladder habits, and then they get a lot of urgency and frequency because they're like, oh, I can just go use the bathroom like when I feel like I have to pee just even a little bit, and then they go, and then they go, and then they're going too often, and their bladder forgets how to be able to hold it longer.
Oh my gosh.
We regress to being a baby again.
Yeah.
So
That's really interesting.
So is that a muscle thing when you can't hold your pee as long?
Yeah, muscle and brain, like the
muscle
whole
brain
connection.
thing. Oh, okay, all right, interesting, super
Yeah,
interesting.
that is really interesting. So you're also had never really thought about that. I mean, obviously, COVID was very stressful, and we all know that. But I didn't really think about how not only is the extra sedentary lifestyle that went along with COVID, combining that with the stress and where people hold their stress as well can definitely impact whatever joints where that pain is manifesting itself. That's really interesting.
Yeah,
for sure. Now, would you say that any pelvic floor dysfunctions are preventable?
are they inevitable or?
Yeah, is it like, are you kind of just?
What can people do?
Yeah.
I think that they are preventable. It depends with what you have going on with your pelvic floor.
Okay.
So, for example, somebody going into pregnancy and postpartum, during pregnancy, working on your pelvic floor, making sure the muscles are relaxed enough and they're not carrying a lot of stress because now they have a whole baby on top of them and it's more stress on those muscles. So making sure that they're relaxed but also strong at the same time. So doing exercises that can definitely prevent leakage afterward or any pelvic pain afterward. And then also not just the pelvic floor, but the rest of your body too, like making sure you maintain your core strength during pregnancy and the muscle imbalances that come along with pregnancy and your posture changes. So like, for example, hip flexors get tight a lot of the time with that pregnancy posture. So the pelvic floor and then also the rest of your body, there's definitely exercises and measures that you can take to prevent pelvic floor dysfunction.
Okay, yeah. Very cool. Would you say there's like if you're going to take a big picture view, like what sort of things can people do, obviously to contribute to their general health, but kind of, what are some best practices to preventing potential pelvic floor issues in the future? Not necessarily specific exercises, but just sort of best practices.
So best practices, I would say working out in general. So having hip strength and core strength will help set up your pelvic floor for having a good life going forward. So just keeping your body strong and healthy in general. Posture too, because the more hunched over you are, technically the more pressure that puts on your pelvic floor.
Oh.
And so having good thoracic mobility and sitting up straight and being able to have that range of motion in your upper back that goes away when you're hunched over all day, like maybe sitting at work, is also important. So I would say overall posturing and strength in your body will help internally to not put extra stresses and forces on the internal muscles.
Yeah, cool.
Oh my gosh, I just thought when you talked about thoracic, that's the upper back, for anyone who doesn't know that made me think of, we just interviewed another physical therapist the other day saying what she's seen more upper back mobility issues after COVID. So I think those two things are definitely related.
I agree
the upper
with
back
that.
and the tailbone
I agree with that.
pain.
After COVID, I was, at that point, I wasn't entirely just pelvic floor at that point. I was treating everything at that point. And I did see an increase in neck pain, back pain, upper back pain because people, the combination of, I think, work environment changing and stress.
Wow.
Did see a lot
But
of
I never
that.
thought that would translate to pelvic floor
Yeah.
dysfunction when your upper back isn't working.
Yeah.
That's amazing. Okay.
Yeah. I was going to say, you physical therapists must hate chairs or love them. I don't know. Right?
I don't hate chairs. I
Love
encourage
them.
everyone to have a standing desk so they don't have to spend like their whole workday sitting.
Yeah.
No matter what your problem is, I say if you
Yeah.
have a standing desk, a standing option, I always encourage that.
Mm-hmm.
That's cool.
Nice. Now, in the case of age, right? What are we talking about? Like, as people get older, are there more, as we age, are there definitely more dysfunctions that, are, more common in a specific age range?
I treat a big range of ages. The youngest I treat is typically maybe like teenagers, 20-year-olds, and like people who have not had a baby yet. And typically I'll see them for something related to pelvic floor muscle tightness. As people get older, what I see is their bodies do change, and it can be because of some different reasons. It can be because if they have had kids in the past and they haven't really taken care of their postpartum issues, then it just kind of gets a little more noticeable as they get older. So sometimes it'll just be issues from having kids, and then 20 years later, they're like, okay, you know what, this is really bothering me. I want to do something about it now. Or sometimes if people just have like bad habits over time, like bad posturing over time, or like their breath holders or stuff like that, over time it can put different forces on their pelvic floor, and then they'll start noticing it. And also, as women get older and they go through their perimenopause, menopausal time, their hormone changes, that can also exacerbate a lot of issues that were either there before or weren't there before, but now they're like, what are all these new issues? So with aging, we have hormone changes, we have just like years and years of bad habits or bad posturings, and that can definitely add up after some time.
Yeah.
So I'm interested in what you said about, like, if you didn't take care of something postpartum and then it lingers for 20 years and then keeps getting worse. So that's really interesting to me that taking care of something in your early 20s will benefit you like decades later.
Definitely.
Okay.
Like if you have a diastasis and you just don't take care of your core, and then your core is functioning poorly for 20 years, that's not going to be good for your body. And it can definitely result in more leakage, more low back pain, a lot of different problems. Yeah.
Yeah. I mean, I guess it makes sense. We, as being personal trainers, we don't deal a lot with the pelvic floor. It's, lower backs, shoulders, stuff like that.
Yeah.
And so that principle we run into all the time, right? Oh, okay, you've been doing this for, since you were 20 years old, now you're 50 years old, and of course these issues are manifesting themselves. But it is super interesting to learn more about the pelvic floor and just how impactful it is and how significant it is, in terms of your overall health. It's not something that's really talked about a lot in our world.
Yeah, it's not.
Yeah.
And I learned a statistic in school, 80% of people with low back pain have pelvic floor dysfunction.
Oh.
So it's actually very, very related to low back pain, which is something that you guys see all the time, I'm sure.
Well, they're right next to each other.
Yeah, they are.
Yeah.
Like the pelvic floor is like the bottom.
Yeah.
And then your abdominals and low back muscles are the sides and the front and the back.
Well, that would make sense, because if the pelvic floor is like weak or imbalanced, the lower back's going to want to compensate.
Yeah.
Yeah, that makes sense.
That's right. Like if it's weak or imbalanced, other muscles will have to compensate, like you said. And that's why it's important to have like your core and your hips working well.
Wow.
Very cool.
Fascinating.
Cool. Well, before we start to wrap this thing up, Lynette, did you have any other questions?
I have a ton of
Which one?
questions, but
go for
the
it.
good news is
Uh-huh.
she's doing a workshop
Right.
here in our gym, so we get to learn more from her on January 7th.
Yep.
Workshop here in the gym. So if any of this, if you've got more questions like I do, come to the workshop on January 7th, 2023.
Yeah, and I will have my pelvic model then, so you can
Yeah.
see even better. I really should have brought it, but you'll
Right.
be able to see even better the muscles of the pelvic floor and how everything really is related to each other.
Very cool. Yeah, we're gonna learn some exercises, learn a ton of stuff. So yeah, very good. I like that. Very cool. So it sounds like if you work out in a gym, you want to be able to do things related to your upper back, your hips, your core, your glutes,
Yep.
and so the reasons for working out, I know everyone's probably thinking, new year, new me kind of thing. It's like goes way beyond weight loss, right? This is all about how you're going to function and enjoy life in the future,
Yeah.
right? Enjoy
Yeah,
life
and
without
just-
having to run to the bathroom every 5 minutes.
Yeah, just because you're skinny doesn't mean
Right,
you don't have these problems.
right,
So
Yeah,
exactly.
for sure. Cool. Was there anything else you wanted to let the audience know about? Was there anything you had in mind?
Well, how do they see your social media?
So my social media, I have Instagram, and it's alpha_project_pelvic_floor.
Okay,
And Alpha Project Pelvic Floor. So just underscore between each of those.
Cool.
So my Instagram is what I recommend if you want to look at
yeah,
social media. I just started TikTok, but it's I posted once on it so far. But it's Alpha Project_Pelvic Floor.
cool.
So right now I recommend my Instagram for social media.
And you've got a website.
Yeah, alphaprojectphysio.com. And it's Phyzio, Phyzio.
Oh, ZIO.
So
okay.
alphaprojectphysio.com with a Z.
Very good.
Cool.
Very
We
good.
can link all that stuff in
So,
the show notes.
Yeah.
so what do you think we didn't put this in the questions, but what do you think the biggest myth or false belief that people have about the pelvic floor?
So I think the biggest myth/false belief is that you just need to do Kegels. Like every pelvic floor dysfunction, people are like, oh, you got to do Kegels. Oh, you got to do Kegels. And Kegels, they can be a helpful exercise. But for some dysfunctions, if people have tightness in their pelvic floor, just contracting it, that's just going to make the tightness worse. So if you have like urgency, frequency, pain with intimacy, tailbone pain, if you just sit there and do Kegels and nothing else, then it can make your problem worse.
Whoa.
/ like it won't fix the problem, probably. And for people who do need to strengthen their pelvic floors, Kegels can be helpful, but we want to make sure you're doing them with the correct technique. And that's what I'm here for. I can tell somebody if they're doing it with the correct technique and how strong it is. And then also what else do they need? Like what are their hips doing and what is their core doing? Like what else does their body need besides just doing Kegels? And also sometimes people, if they have tight and weak pelvic floors, we need to relax the pelvic floor down before we go contracting it. So it's more complicated than like, oh, just do your Kegels.
Yeah. Oh my gosh. All right.
Man, there you go.
There's a lot more to this than we knew.
Yes,
Yes.
there's a lot to it.
So do you feel like, in your professional opinion, do you feel like every person that gives birth should go to a pelvic floor therapist?
I do. I think one day it'll be like that. I think it'll take a long time.
I agree. I feel like it's a big deal.
Yeah, it is a big deal.
It's a big deal, and it should just be part of like the same way after you get knee surgery, you go to physical therapy.
Right.
After you have a baby, you should go to physical therapy.
I think so too. Yeah.
Yeah.
That's
can't-
that's our little soapbox.
Yeah. I mean, I think I'm with you guys. Like, I can't tell you how many clients, usually like female clients
Yeah.
over the years that I've worked with who just,
Yeah.
oh, good. Oh, we're doing jump rope. I got to run to the bathroom.
Right.
It's
Or
just
like
so.
they just won't
it's,
jump or
yeah. It's so common. It's
people
definitely-
wear pads, people wear dark pants
Yeah.
because they're worried about it. So there's a lot of things that
Yeah.
people worry about at the gym that maybe they're not saying.
Yeah.
Well, and for years we thought, well, that's normal. I've had a baby.
Yeah.
Or that's normal. I'm over 50 or whatever.
Yeah, that's one of the biggest myths too. Is like,
Yeah.
oh, you've had a baby, you're gonna leak. Like that's just how it is. That's how it's gonna be. But like, it really doesn't have to be that way. You can still do something about it.
You just lit up so many people's worlds right now. I'm like, oh my gosh, I don't have to live with this. There's something I could do about
You
this.
can, even if it was a while ago that you had your baby, like you can still do something about it.
I'm going to put poise out of business. All right. Awesome.
All right, cool. Last question we've got for you. What are 3 things that elevate your life?
So I think 3 things that elevate my life are my work and my family and my friends. So my work, obviously, I'm really passionate about pelvic floor physical therapy. Like I love it, and I want more people to learn about it, so they don't have to just think that what they're going through is normal or can't be helped. So my work definitely elevates my life, and we take it seriously at Alpha Project. Like we take our work seriously. And then my family is a huge part of my life too. Like my parents and my sister, like we are all very close and help each other a lot. And then my husband too. We like push each other and grow together a lot. And then my friends, we always choose our friends. Like we choose people around us who we think will elevate us.
Ooh.
And if we don't choose friends who we think are going to elevate us, like that's not really the best choice in friends. So I think surrounding yourself with people who will elevate you is important.
I love that.
Very cool.
That's good.
Very cool. Very cool. Well, we appreciate you coming on. This is very insightful. I think it's going to be really helpful for a lot of people.
Yeah.
You got anything else before we sign off?
Nope, that's it.
All
Thank you
right.
for having me. I'm excited for the workshop.
Yes,
Yeah,
we're very
it's gonna
excited
be
about the
great.
workshop.
Yep, January 7th.
Sweet.
All right. Hopefully this was helpful, guys. We will talk to you next time.
All right. Bye.